Welcome to Life's Undertaking. I'm your host, Brad Jones. With me as always is my good friend, producer, co-host is Mike.
Brad, how you doing today?
I'm doing fantastic. And if you're watching on one of our streams, you'll notice that I actually have a guest in studio with me. I'd like to welcome my guest, George Takach.
Hey, Brad, good to be here.
Yeah, it's great to have you here. So George, you and I spoke, it's got to be almost a month ago now, I think it was. You sent me a quick little email, and then you were speaking at another engagement that Tammy was at that event, and I got some great feedback from Tammy. But I'd like to get some more information. George has written a book about MAID. I can't remember the title yet off the top of my head. I've skimmed through it. I read the first few chapters, and then I had to skim through the last few chapters. It's definitely harder reading it on your phone than an actual in my hands, but I
actually brought you a copy.
I'm looking forward to reading the whole thing now.
Absolutely. And the title, just in case anybody's interested, it's called The Book of MAID.
That's right, The Book of MAID. That's right, and it just came out in August.
Yeah, The Book of MAID, Understanding Medical Assistance in Dying in Canada.
So what got you interested in writing a book of MAID? Like I've heard a lot about MAID. I've worked with a lot of families that have chosen MAID, and I'm really curious what got you really interested in writing the book about MAID.
4 things very quickly. First, when my parents died, my mom about 10 years ago, my dad about 15 years ago, they both had very difficult dying processes. And particularly in the case of my mom, she died just before MAID was legal in Canada. And she was very, very disappointed that she couldn't take advantage of it. Second, I'm a lawyer by training and profession. I practiced law for almost 40 years. And MAID is a product of the legal system in this country. So I've always followed MAID as an interest for a lawyer. But I obviously understand the legal implications of MAID and how it works. So that's sort of reason number 2. Reason number 3 is very interesting. More recently, 2 of my friends, so my age, I'm late 60s, their parents, their respective parents, a mom in one case, a dad in the other case, chose MAID. And while MAID worked as it's intended to work for the elderly parents, the kids didn't have an optimal experience because both parents didn't manage the family situation the way, frankly, it should be. So in the book, which isn't a long book, it's short, it's written for, everyday people to read and understand. The second chapter, short, all the chapters are short, is actually about managing family situations around MAID, because it does present some interesting scenarios. And then the 4th final reason quickly, there's a lot of misunderstanding and a lot of confusion around MAID, and the legal system hasn't helped. We started with one law, and then it got changed after 5 years, and now there's a second law, and it's different from the first law. So I really thought the market could use a plain English, easy to understand, keep to the facts kind of book, and that's what I've written.
It's actually, the part that I've read so far, and there's only 144 pages if I'm not mistaken. So you're right, it's not a long book, but what I've read so far, it was actually kind of eye-opening when you looked at the statistics. I guess the last part of statistics came back from like 2023, I think it was. But the number of people that have chosen MAID, the number of people that actually were rejected by MAID, actually that's what surprised me more than the number of people that chose MAID. And I know there's been a lot of comparison between MAID in Canada and MAID in California, and not just because of the trade war going on right now, but the medically assisted in dying. And they've had it about the same length of time, if I'm not mistaken, as a legal way to end your life. And the number of people in Canada was a lot more than the number of people in California. And I've heard people saying, well, in Canada, it's because, the doctors are, providing this more often than they should be. But you have actually a chapter in there where you talked about that, and it's their responsibility and their obligation when somebody has come to the end of life to give this as information. And I think if I'm not mistaken, I imagine in the States, in California, they choose not to provide that as an option because they can make more money selling treatments than they can with helping with a MAID request.
Wow, I counted at least 5 questions in there. So let me try to take, because each one's a good question. So let me take each one in turn. So the first point, the statistics that we have are actually from 2024. And we're recording this August 25th, 2026. So the 2025 statistics will be out in a couple of months. So the book drives off of the 2024 statistics, and the federal government, a feather in their cap on this one, every MAID procedure requires the physician who does the MAID provision to actually fill out a very long form. So we have very good data over a whole range of questions. In terms of the numbers, in 2024, it was 16,500 people in Canada, which, if you think about the total number of deaths in the range of 330,000, it represents what we would call a 5% participation rate. So 5% of the people who died in Canada in 2024 had MAID. Now, in California, in Oregon, there's 13 states in the U.S. That allow MAID. Their participation rate is 0.7%. So you're absolutely right. It's a much lower participation rate. And there are at least 3 good reasons for that. I'll run through them very quickly. To me, the main one is that in the United States, once you've elected to have MAID, there's only one process, which is you go to the doctor. If they're convinced that you've got a prognosis of less than 6 months to live, they will write you a prescription. You then take the prescription, you go to the drugstore, you pay $3,000 or thereabouts for the drugs, and then you go home and you put them on the shelf and you wait till the moment where you feel you're suffering so much you just can't go on. But then you have to create your own little cocktail out of those medicines, and you have to drink it yourself. Now, it's not every second person that has a bad reaction. It's actually quite a small percentage, but you don't know if you're going to be that percentage. In Canada, in 2024, literally everyone across the country, all 16,500 people, they could have elected that process of a cocktail and drink it yourself. Not a single person did. They all have what's called doctor-administered medical assistance in dying. So a nurse puts an IV in your arm, and it's basically like if you've ever had an operation where you've got an anesthetic through an IV. That's the process. It's painless. It's faultless. It's death in 8 minutes. It's very quick and to the point, but without any pain, without any suffering. Whereas you do get a few stories in the States of people either choking or regurgitating and so on. So the U.S. system, frankly, is to try to discourage MAID as much as anything else. So that's the other thing. Your point about physicians wanting to keep people alive for financial reasons and so on, I would be very skeptical about that. These are people that, for the most part, are at end of life. Even in Canada, the most typical MAID provision, 2/3 of all of those 16,500 MAID provisions were for terminal cancer. So they're hastening death by 2 months, 3 weeks, 6 weeks, that sort of thing. And there's a lot of talk on the internet about how the government, created MAID to save money. That's just false for one big reason, which is the government didn't give us MAID. It was the Supreme Court that gave us MAID. And the government actually, I say in the book, there's a chapter in the book about a brief history of MAID. The government has always been reluctant to bring in MAID. And even when the Supreme Court said, no, people should have this right, the government tried to narrow it. So this false, frankly, narrative about, saving money. But the last point, and I'm really glad you pointed it out, because I think I do something in the book that's quite unique when you mentioned how many people are unsuccessful in getting MAID. Nobody has done that yet in a book. And although there were 16,500 MAID cases in 2024, there were 6,000 requests for MAID that went unfulfilled. And the reason I put that in the book is because there are lessons to be learned from it. And the big one being a lot of people who want MAID leave it too late. They think, I'll just move forward with palliative care, which is fine. And if I then find at some point that this really is suffering that's intolerable, well, I'll just call up at 10 in the morning and I'll have MAID at 2 that afternoon. And unfortunately, that's not how it works. And so a lot of people do suffer pretty dramatically in the last 7, 10, 14 days of their lives.
Well, yeah. And, the process is actually pretty intense because you actually meet with the doctor, I think, on 2 occasions before you can be approved for it. But even after the MAID is completed, I think it's within about 4 or 5 days, a week, an organization from MAID will actually call the family and get feedback on the process. And I'm speaking from experience. We've had a family member that chose MAID, and I was able to be, present with 2 people that died. When my dad died, he died in hospital. He had been suffering from Alzheimer's, and he would have loved to have taken MAID, but it wasn't an option because he was so far gone. Right. And then my father-in-law, who did choose MAID, and it was, his choosing. It was, and he did it right. He spoke with the whole family. He told us what his wishes were. It was a very beautiful setting. We actually had everyone together, the entire family, for the, to be with him. And it was a very special time to be in, as difficult as it was to actually, do that. But I know myself, my wife, Jody, and I, we've talked about this all the time about MAID and things like that. And we're not sure, we're young, so we're not sure if that's something that we would choose at this point in our lives, but, we've all said it. And, you talk to any group of funeral directors and every single one of us will say the same thing. If I ever get that bad, I just want to go. We've seen the results of people that have had to suffer. We've seen the people that have been struggling, and we all say the same thing, that if I had the choice, just let me go. Like, don't keep me alive. Don't keep me going. So I think with the more education we can have about what options are available, I think the better choices people make.
Yeah. And that's really the essence of the book. Is I absolutely understand that there are some people who are very in favor of MAID, and then there are some people, for various reasons, who are not for MAID. And that's perfectly fine. It's everybody's individual choice. And just to, really drive this point home, because legally it's a critical part of the MAID system. And you mentioned was your dad with Alzheimer's. Mm-hmm. So today in Canada, except in Quebec, and we can talk about that in a minute, but in Ontario, for instance, which is relevant, I think, to most of your listeners, you have to be able to consent to MAID to get it. So if you do not consent, or if you cannot consent, nobody is going to perform MAID without your approval. And the consent typically comes twice in the process. So when you request initially to start the MAID approval process, and you're absolutely right. It's pretty intense. There are 2 assessments by 2 different doctors. And at that point, both doctors, one of the things they're going to be looking for is, do you have the capacity, the mental capacity to consent to medical treatments generally, including MAID? And if you don't, then you will not be able to have MAID. And then as you go through the assessment process, and let's say it's 3 weeks later, you've been approved, you've been found eligible, just before the injection of the drugs that will end your life peacefully and sensibly, the physician asks one more time, Brad, just to use you as our role model here, do you understand what I'm about to do? And is this what you would like to have done? And so in both cases, you have to have that capacity to consent. There's an exception if you, during the assessment process, look like you might be at the point of losing the ability to consent, or you're on drugs and those are taking away your capacity. There is a way to get a written waiver of the final consent, but it's only when you've already scheduled the MAID procedure. It's 2 or 3 weeks down the road. So it's a very small period of time. But for instance, with Alzheimer's or dementia more generally, we do not in Canada have a process called advance requests for MAID. So you can't say today, I'm going to sign a piece of paper, and if I ever lose the ability, for instance, to carry a conversation, or if I can't recognize my spouse or kids, that's the point at which I want MAID. We don't have that system in Canada. So what you have to do, and I talk about this in the book because it's frankly one of the most misunderstood parts of the MAID puzzle. If you're diagnosed with dementia, let's say on January 1, typically, whether it's caused by Alzheimer's or one of the other many, many causes of dementia, you don't typically lose capacity right away. It's a decline, and you will lose capacity, let's say, over 16 months. But for the first 12, 14 months, you still have the capacity to consent to MAID. And typically, just before you lose capacity, the second requirement in the eligibility criteria, which is that you have suffered a decline, there's a consensus in the medical community that you will have qualified for that. In other words, you can have MAID for dementia, but you have to have it before you lose capacity. But if you're thinking of avoiding the 8 to 12 years where you don't have capacity, you spend a lot of that time in an institution. Some of it can get very, very dark and very, very unfortunate. And in 2024, 348 people had MAID just because of their dementia. So it can be done.
Yeah, and I think that was the smallest cohort of people that chose MAID was probably people that had the Alzheimer's or dementia. Cancer seemed to be the biggest group.
Yeah, cancer is clearly by far, it's 2/3. It's followed by heart disease and cardiovascular. A lot of lung disease, pulmonary, proportionately much higher than the number of people that die from heart disease. And then there's some very interesting diseases that people, frankly, aren't really up the curve on. One is frailty.
Mm-hmm. Yeah.
If you're falling and you're falling a lot or even just once, frailty is a serious medical condition. But it's very interesting. If you look at the studies, there are 3 degrees of frailty, sort of mild, moderate, and then severe. So if you're going from mild to moderate, a physician might say, well, look, with some exercise, diet, some other things, we can get you back to mild, in which case you'll be refused MAID. But if you're going from moderate to severe, the studies show that you tend not to come back from severe. So that's where, and just to review the 3 criteria, you need an incurable medical condition, so frailty. You need to have this decline in capability, which again, frailty would comply. And the third one, and it's really the one that sets our MAID apart from virtually every other one in the world, except the Dutch, who are very similar to us, is you have to have intolerable suffering. And if you meet those 3 criteria, you're eligible for MAID, including, and this goes back to dementia, other chronic diseases. So take something like multiple sclerosis, MS. You cannot get MAID in the United States for MS or dementia because they only allow MAID in the 13 states that have it. There are a lot of states that don't have any kind of MAID. But in the ones that have it, you mentioned California or Oregon, where it all began in the States, you can only get it for essentially a terminal disease with a prognosis of less than 6 months. So when I was researching the book, I read at least 24 books from the U.S., from caregivers, and it was the most heart-wrenching reading I'd ever done. The caregiver taking care of someone for 10, 12 years. And what happens in the States is they use up all of their savings. And it's typically the guy who gets it because he's, let's say, 8, 10 years older. And then finally, he dies of Alzheimer's or whatever the cause is of the dementia. And then there's the woman at age 71, but now penniless, and because they don't have an option. Now, you can still choose, as it were. In fact, in Canada, if you don't choose, you're going to have what's traditional.
Yeah, our palliative care system.
Right.
Yeah, the medical system will be there to assist. Yep.
Right. But just to reinforce, because this is probably one of the most misunderstood aspects of MAID, if you don't put up your hand and ask for it, you're not going to get it. Now, one last thing that you mentioned, which is very interesting. If you have a medical condition that could qualify for MAID, the Canadian medical standard is actually that physician should bring up MAID with you. Again, you see this a lot in the press. Oh, the physician was pushing MAID and, was really trying to get the patient to have MAID. No, that's actually not what's typically going on. If you have, for instance, an oncologist discussion where he says or she says, look, we're at the end of the road. There's nothing more to be done. Here's my palliative care recommendation, and so on and so forth. At that point in Canada, that physician actually is obliged to say, and by the way, I should talk to you about MAID, or here's Dr. X who can talk to you about MAID. And I think that's tremendously sensible, because what you want as an adult is you want to know your options. And this whole game of hide and seek about, oh, you can't get MAID in this hospital or this hospice and so on. We need to get past that.
Yeah, no, I definitely think that the more education people have, the better choices they make. And, again, it's personal choices. And I think this is one of the things that we as adults and as Canadians, we really want, is be able to make the best decisions for me and for my family, and not to have the decisions forced upon us by, anybody. I think, there's not a lot of information in the public domain for MAID unless you actually go looking for it. So I think when the people are at the end of life decisions, I think it's a fair expectation that the medical professionals would actually bring up that information to you. It's no different than if they bring up the palliative care options for you. I can go back to 1998 when my mom died, and I can look at how poor the home healthcare system was in Canada back in 1998 because a lot of it was on the shoulders of the family. I think if you didn't ask the questions, the medical professionals didn't have a lot of answers or information for you. If you weren't in the hospital, you're on your own. You had some visiting nurses that would come through, but we've come a long way with our palliative care hospitals or palliative care floors. We've come a long way with our hospices. I think almost every community in Ontario has an amazing hospice now. And I think having the option for MAID and having that ability, and you explained the difference between Canada and the United States and how the process works, and it is a comforting process in Canada that you actually have a medical professional with you, assisting you through that process right to the very end.
Yes, and the good news, if I can put in a very subtle plug for my book, is that you can now, for $19.95, go to Indigo or order it wherever you get your books and get a sensible, easy to read, straightforward book. What I found with a couple of families that have bought the book is the adult children each get a copy, and it's almost like a book club. And they go through it with mom, with dad, because, it's the adult kids that are also not stepping up in many cases when, the 82-year-old or 84-year-old dad or mom says, look, kids, I think I want a discussion about a range of issues involving my health. And some of the, 62-year-old or 65-year-old kids say, oh, mom, that's so silly. You're going to live forever. You're going to outlive us and so on. Your mom is asking for a respectful discussion about end of life. And it doesn't have to be, every Friday night or every Sunday dinner or anything like. But every now and then it's worth sitting down and everybody goes around the table and, what's your view and so on. And having a good little handbook to kind of help facilitate that, I think, was the fifth reason for writing it.
Well, I would say the same thing happens for people with pre-planning their funerals and talking about funerals is, we have the same thing. We have the parents bringing it up to the kids, and the kids don't want to have that discussion. They don't want to talk about it. But I can honestly say that every funeral that we've had that's been prearranged, the kids come in afterwards and say, I'm so happy that my mom and dad did this. And I think when it comes to, MAID, I think having those discussions beforehand and having that roadmap in place, I think it makes it easier. And I think having those discussions with your kids, I think it gives them the opportunity to, to spend that time to think about what's happening and leave nothing unsaid. It's such a great opportunity to, be able to say, I've really, really respected this in your life. I really love this. And, I care for you a whole lot, because there's lots of people that don't get that opportunity because a death happens suddenly and they didn't get that opportunity to say goodbye and, to tell people what they feel and they like. And I think that's one of the beautiful things about MAID is when something is coming, it gives you a chance to prepare. And I'm not saying it takes the sting out of death. And I'm not saying it makes death any easier or less emotional, but I think it gives you that opportunity so you don't have those lingering questions in your mind afterwards of, did they know?
Yeah, and there's a whole piece around MAID that is a little bit unusual because it isn't the traditional way to go through a dying process. And so what do you do if there are, let's say, two adult children and one is predisposed to doing MAID, likes the idea, and another one is opposed to it, maybe for faith reasons or what have you? Better to air that issue and the diversity of opinion early on and get to a place where ideally the child that is not keen about MAID at least gets to the place where he or she says, you know what? it's not what I would do, but this isn't about me. This is about my dad, or this is about my mom. And I'm going to respect their decision, and I'm going to be supportive because it's their issue. And then when my time comes in X years, I'll expect my sibling and so on and so forth to respect my decision. And that's the only way this is really going to work. And you must, again, I liked your analogy to pre-planned funerals and so on. Better to air some of those divergences early on, deal with them, be sensible about it, so that when the time does come, people aren't scrambling and stepping on people's toes and leaving a bitter taste in the mouth, which is so sad. I mean, there's enough already to be aggrieved about, and bereavement's going to be a big issue regardless. But let's try to kind of resolve some of these earlier issues when we can.
Yeah, and I think knowing that your family member actually had that opportunity to make the choice, I think it for me, it gives you some peace of mind. And there's nothing, well, I'm not going to say there's nothing worse than watching someone suffer, because I think, being on the other end and actually suffering, it might be a little bit worse than having to watch it. But I can go back to my mom. She had fought cancer for almost 10 years before she succumbed to it in 1998. And, it was, she didn't want to live like that at the end. She would have, preferred to have had that as an option, which wasn't even on the radar back in 1998. But, I think, I've worked with so many different families that have experienced MAID over the last, 10 years or so. I can still remember the first family that we had that had chosen MAID, and the way we actually found out about the death is the lady who had chose MAID had actually put her notice into the newspaper. She had sent it in by email that day. The newspaper called us to confirm that this was a true death, and as the newspaper had called us, we actually got a call from from her saying, "I just put this in, and I've chosen this process, and it's going to happen now." So that was my first experience with MAID. It was a little bit shocking, but that was somebody that she had decided what she was doing, and she was cognitive enough that she'd put her own obituary together and sent it into the Toronto Star that day. So it was a bit of an eye opener to see how that can work.
Yeah, you're starting to see some very interesting scenarios. There was one in the Globe just last week where there's an obituary from a woman, and then just below is her husband. And they both died the same day. And now they didn't mention MAID, but when you see two people going on the same day like that, there's a very good chance that it's MAID. And again, part of the book is to get people simply socialized about, there are some new trends out there. Again, you don't have to choose it. I talk to people of faith all the time about MAID, and for a number of them, the suffering process, they look at John Paul II, the Pope that had a very long dying process and so forth, and they say that Christ also had a long dying process. And if that's where your head is at, that's fine. Like, nobody is going to take that away or threaten it or anything like that. Everybody, hopefully, is just going to respect that. But at the same time, if, like in the Globe last week, you have a couple, I think they were married 62 years. I don't know any of the facts, so I'm just, surmising here. But I assume they were both, to get MAID, they had to have been both suffering from an incurable disease. They had to have had this decline. And they were suffering intolerably, and they both said, you know what? If if you're going to have, I don't want to, and they both decided something like that. So, and then the other one that we've got to get used to, and it's going to be the toughest one, because I think with, a terminal cancer, people can wrap their head around it. But with something like MS, where let's say you're diagnosed at 52, you've had 10 years of decline, and you know the trajectory for the next 15 years, and you're about to be, going into institutional care because you're losing capability. Someone who at that point chooses MAID, it's going to be more controversial because you can point to thousands of people in institutional care who've presumably made the decision that, it's not great, but I've adjusted. And some family members and friends and so forth will say, well, why won't you adjust, Bill or Sally? And again, my response is, this is Bill or Sally's decision. And if and when, heaven forbid, you've got a disease that is chronic and is debilitating, you'll get to make that decision as well. But Bill and Sally are making it at a certain point, and let's just respect that. That'll be the tougher one to get used to, because there really is choice there. Whereas, terminal cancer, I think everybody is starting to wrap their heads around, well, yeah, you were going to die fairly soon anyway.
Yeah, I would agree. And, when you say there was like 16,165 people in Canada, and the majority of them are, 95% are probably a terminal case of something,
yes.
Then, the death is coming, right? It might have just moved it a little bit sooner than it would have come. It's definitely a lot easier to wrap your head around a terminal illness that you can see a massive decline in health. But again, I think it's one thing to be the observer on the outside and, see somebody struggles with, whether it's MS and mobility, whether it's a cancer, and it's a different thing to be the person that's living it. And it's not just, they're not just in pain when you see them, they're in pain all the time. They're not just suffering when, families, in the room with them, they might be suffering, 24 hours a day. So, yeah, you can be medicated and it can help it, but I think it comes down to, and again, it comes down to a lot of things for all of us is our own choice and our own belief system. And as long as we, can respect people's choices and people's beliefs, then I think we'd all be, a lot more comfortable with this whole process.
I'll just say hallelujah to that.
Well, George, I want to thank you again for coming on Life's Undertaking. And I know you mentioned that we can get the book in Indigo. I'm assuming you can also order it on like Amazon if you want to get it that way. Is it in Audibles yet?
Well, it's funny you should ask. So the Kobo people have it in ebook form. Yes, it is up on Amazon, Indigo, other bookstores. And my publisher called the other day and said, wow, initial demand is such that they'd like to do an audio book. And I said, well, I'd love to narrate it. And so who knows, we might be back in this very studio doing an audio version, but hopefully that should be out by, the end of the year kind of thing.
Well, you definitely have the voice for it.
Okay.